Sending your kids off to college for the first time is exciting, but it can also be stressful, especially if your young adult has inflammatory bowel disease. Joining us now to discuss is Dr. Jeffrey Bornstein, who is the Chief of Pediatric GI and Nutrition here at Orlando Health Arnold Palmer Hospital for Children. Thanks so much for being here with us.
Thanks for having me.
Okay, so this is a big problem because IBD does not go away. There is no cure for it. There's a lot of treatment, and kids have to really be regimented about the way they manage it. What happens when you see your patients heading off to college?
We have patients all ages with inflammatory bowel disease, both Crohn's and ulcerative colitis. We've been to college. We know what it's like. We know what goes on. Let's be honest, and I'm very honest with them and in front of their parents. When it comes to the diet, in reality, I tell them all, if I can get them to avoid eating all junk food, they'll be better off. I don't try and restrict their diet too much because in reality, it's the high processed carbs and the refined starches that all are the worst thing for them. And the other big thing we talk to them about is sleep. If they run themselves down, if they let themselves get exhausted, they are much higher risk to get sick again.
And you do have an incredible team. You have a lot of nurse practitioners that are really on the front lines with your patients and, you know, checking in with them regularly and making sure they're okay and they're doing as well as they can. Tell me a little bit about Terry.
Oh man, Terry Jackson. She's an angel on earth. I'm telling you. Terry has run this program. It's amazing. She's the one who takes the responsibility for all of our health maintenance visits. Half of what we do in IBD would not happen without her.
So Terry, the transition between high school and college is really important. I mean, it's exciting and it's stressful, but for kids who have some kind of GI issue, what are the things that you do for your patients to help them get there?
So one of the biggest part of my role is to help to educate our patients and prepare them for moving over to college. We in our practice will continue to see our kids through college, where many practices may discharge patients at 18 years of age. But because we think that this is a very crucial time in their development, we continue to follow those kids, but we also help to prepare them getting ready to go off to college. We feel that if we can help to prepare our kids by giving them education, by being able to help to let them know about what kinds of things to expect, how to be able to get ready to take care of themselves when they go off to college, they can be more successful.
It's another reason to choose well with Orlando Health. And if you would like more information, you can visit arnoldpalmerhospital.com/kidsIBD.